People, when they collapse, when they're doing exercise, when they're in the gym, or when they're playing, it becomes a bigger news. There are a lot more people who are experiencing cardiac arrest when they're not doing anything, but that doesn't get reported. See, out of 100 cardiac arrests, say 5 happen during exercise or in the gym or while playing some sport. That comes in the news, that gets reported. The remaining 95 cardiac arrests, which happened during other activities or during sleep or when the person was at home, that doesn't get really reported. So what happens is, it looks like all cardiac arrests are happening during exercise, during sporting activities, during gym, during running. It's not so. Most of the cardiac arrests tend to happen among sedentary people. It is difficult to give a blanket statement on all the deaths that happen, because some of them may be having a previous cardiac history which we are not aware about. Some of them may have some undiagnosed cardiac condition which has not come to light till now. Cardiomyopathies, which are hereditary, where the cardiac function is abnormal, or the heart muscle itself is abnormally thick, or other abnormalities in the heart muscle are present due to genetic causes, notoriously tend to be asymptomatic. And the first presentation could be a cardiac arrest. Some of these cardiomyopathies and some of these rhythm disturbances, which may be caused by certain electrical disorders of the heart, can be asymptomatic, and they may present for the first time during a strenuous physical activity like gym or exercise or playing a football game or badminton or something. So these people who have 40-50% kind of blockages may not have any symptoms otherwise. When they do regular activities, they may not get any chest pain, they may not feel anything, but on strenuous activity, a heart attack may get precipitated and they may die of cardiac arrest. Typically happens in people who have not exercised since childhood or younger age, have just started exercising in their 30s or 40s, where some disease has already started in the coronary arteries, but they are not aware because it is not severe enough to cause symptoms. I have definitely seen a steady increase in the number of younger people getting heart problems. This is not a recent one. This phenomenon has been there for the 1 to 2 decades. And Indians and many Southeast Asians are at a higher risk of developing heart attacks compared to Western counterparts. Genetically, Indians are at higher risk of developing heart attacks at younger age. See, in a heart attack, it is a medical emergency. The person is experiencing significant discomfort or pain in the chest, sweating, breathlessness. The pain may be radiating to the neck or jaw or the arm, the left arm or the right arm or the back. But the person is still conscious. The person is talking to you, the person is breathing, the person has a pulse, the person has not collapsed. So in a heart attack, although it is a medical emergency, the person is responding to your what you're asking, what you're telling him, and the person can be taken to the hospital as early as possible, so that the doctors can diagnose if it is a heart attack, confirm the diagnosis, and then go ahead with the further treatment, which may be an emergency angiogram, angioplasty, or if the hospital is not equipped with that, a blood clot dissolving medicine can be given. That is a heart attack. In a cardiac arrest, which is a far more dangerous scenario, the person collapses suddenly, may be preceded by chest pain or breathlessness or something feeling unusual, the person feeling very tired, the person collapses. When you check the person, there is no breathing, which you can check near the nose or by keeping a hand on the upper part of the abdomen if the breathing movement is there or not. Check the pulse. The person usually will not have breathing or will not have pulse. This is basically death unless the person is resuscitated in the next few minutes. So whoever is there as the bystander should check if breathing or pulse are not there. If they're not there, start CPR. When a single person is doing CPR, they should stick to chest compressions, do it rapidly on the lower half of the chest bone or the sternum, what we call, with both hands pushing down rapidly. Do it for 30 times, and then if possible give 2 breaths mouth to mouth. Keep doing chest compressions till the pulse comes back or the person starts breathing or help arrives in the form of an ambulance or the nearest doctor or whoever is there to attend the person. See, ideal thing about exercises, you should start it during childhood and continue it into adulthood. If somebody is starting to exercise at the age of 25 or 30 or above the age of 30, 40, you should have a health checkup done before you start exercising. You should see a cardiologist or a physician. Make sure that your heart is okay. Make sure that your blood workup is okay in terms of cholesterol, sugar levels, blood pressure levels, how is the weight, what is the body mass index, and also look for any symptoms in the sense, if you have any discomfort in the chest or heaviness in the chest on walking. Do you feel unduly tired compared to your peers? When you're walking or when you're climbing stairs, you fall behind, you feel breathless, you feel some symptoms or tiredness because of which you are not able to walk as fast as your colleagues or your peers or your friends of the same age group, and get a detailed checkup done before starting exercising. If the doctor says everything is all right based on the tests, the doctor may want to perform ECG, an echocardiogram, a treadmill test to look at the effort tolerance, and then advise exercise. And once you start exercising, go slow, go gradually, and increase the speed and intensity over time. And during exercise, once you start exercise, if you feel any symptoms like breathlessness, any chest discomfort or heaviness, any dizziness, not able to do exercise beyond a certain point, you should go back to your doctor and get it evaluated more properly and deeply before continuing exercise. If ECG, echo, treadmill test on all the blood workup is normal, most often further tests are not required. If you have a strong family history or genetic background or multiple risk factors, then it may be better to do more tests like CT angiogram before getting onto exercise program.